Trinidad and Tobago has a rich history due to its multi-ethnic community. Our cultural expressions in both food and entertainment make us proud. But our modern way of life, unfortunately, leaves the population vulnerable to chronic conditions such as hypertension. Care for persons afflicted with non-communicable diseases can be a daunting task, as healthcare systems lack the resources for NCD management and have many competing priorities. But with the Hearts Initiative, we are reorganizing how care is provided at the primary care level.
The Hearts Initiative provides a holistic approach to chronic non-communicable disease management, incorporating both public health and clinical primary care in one program. At a population level, PAHO works with the Ministry of Health and technical experts, such as primary care experts, cardiologists, and nephrologists, to tailor-make a treatment algorithm that works best for each individual population. This takes into account access to medication while minimizing side effects and ensuring ease of access, as well as reducing the number of physical pills needed.
Trinidad became a part of this Global Hearts Initiative in July 2019. And it's a partnership between the government of Trinidad and Tobago and the Pan American Health Organization and the World Health Organization. The Hearts Initiative is a new way of delivering health services, reforming the way in which we currently deliver health services in the primary healthcare setting.
The Hearts in the America Initiative is a global drive for strengthening the health system to provide better care for NCDs at the community and individual level. The government of Trinidad and Tobago has been pleased to work with the Pan American Health Organization and World Health Organization since 2019 in reorganizing the provision of care and scaling up of the implementation of this initiative.
This program is part of the government's attempt to get the population to be healthier, to take charge of their health. And let's reverse the burden from being a treatment-based model to a preventative-based model. Take control of your health. But also, we want to start to treat our children and train our children not to make the mistakes that their parents and grandparents made. So that is why we have a whole program about childhood obesity and childhood health. It's a game changer to change the culture of the way we treat with NCDs in Trinidad and Tobago.
For one, it's making it easier to follow our clients. You get better satisfaction and you get results in a faster time. Previously, what happened, independent physicians or different physicians will see clients and they will treat clients in accordance with their knowledge and what they have seen worked for them over the years. With the standardization of the treatment, what you find is that we follow an algorithm, we follow a set protocol that can be followed by the clients, their relatives, as well as the physicians themselves.
The Hearts Initiative is a team-based approach at its core. The patient will come into the health center. The first line of contact is the clerk, who will send the notes to the nursing assistant, who is also the screening nurse. The patient, of course, meets the screening nurse as well. Where the blood pressure is taken, a short history is done. The nursing assistant or the screening nurse will take the patient and the notes to the doctor, where the patient is interviewed and further counseling done. Medication may or may not be changed. The patient is then sent to the district health visitor or the nurse associated with the program. There the patient receives a greater amount of counseling done on lifestyle changes that can be made improvements. The nutritionist in the Hearts-based team effort will advise the patient on the meal changes that need to be made in order to lower the blood pressures. Simple little changes or maybe big changes. From there, the client will leave the nutritionist and head to the pharmacist, where he or she is given medication as well as advice on how to use the medication. The client then returns to the starting point of the clerk, who reminds the client the appointment time, the appointment date for the next visit, and any further visits that may be required, as well as reminding the client to come in for the next prescription.
So we are working to support the Ministry of Health And beyond that, what we're working to do is actually to help strengthen health systems in Trinidad and Tobago. The reason for us working with the ministry, which is our line ministry, it's because we support the Ministry of Health in taking care of persons with non-communicable diseases. And we are doing that within the context of strengthening health systems overall, which is a critical part of the work that we do at the country level. So the HEARTS treatment protocol is a standardized protocol that will be implemented with persons with NCDs.
They told me then that my blood pressure was too high and that situation has to be addressed and corrected by a change, by medication and a change in lifestyle and what I do. That's when I decided to join the heart group here. I was advised that I need to start testing my blood, recording it so that I can see which way it's heading, whether it's improving, whether it's getting worse, etc. Among the things I needed to do was to change my diet because that was a major contributing factor. What was interesting is that the testing now, I got on the way with my testing of my blood pressure and I started to see the drop that is taking place. Like when I started off, my blood pressure was 155 over 96 and at present it's 123 over 75 and it kept coming down and down. And when I discussed this with the medical people, they said that present blood pressure rate is quite good. Just keep it there.